Knowing your own health risks, what you should be asking your doctor, and recommended lab tests. Thanks for joining me. I'm Corinne Ward, Wellness Coordinator with GMS, located in Columbus and Cincinnati. 2014 had the leading causes of death as heart disease, cancer, respiratory diseases, stroke, Alzheimer's, and diabetes. But fortunately, 99% of disease management is in the hands of individuals as well as their lifestyle factors. Other common conditions to not forget would be osteoporosis, hypertension, hyperlipidemia, asthma, as well as some mood disorders like depression and anxiety. So what is a chronic disease? By definition, it's one that lasts longer than 3 months. Now, most people tend to deal with a condition a lot longer than that. You may know some individuals that have been dealing with most of their lives. In 2008, 78% of people over the age of 55 had at least one chronic condition. As you can see by this chart, there is an increase in the chronic diseases in the United States. The prevalence has definitely been going up since 1995. Some of the reasons for this, they believe, are medical advances. We just have a better idea of how to test for these and how to screen for these diseases and conditions now, so now we're becoming more aware. But the main thing that you want to focus on is your lifestyle factors. Smoking, having a poor diet, lack of exercise, being more sedentary or having a very sedentary day job, and then of course increased body fats. We also do have to note that nowadays we have a longer lifespan. Currently our lifespan for females is 81 and males 76 years of age. This is much different, and back in 1950 the age of life expectancy was only the age of 66. So where to begin? Become aware and get tested. Know your family history. Now, just because your grandma or your mother had a cancer or diabetes doesn't necessarily mean you're going to have it, so it's really important to get tested yourself. Then, you want to practice healthy lifestyle behaviors that you can control. Again, you may not be able to control the fact that you have a tendency to gain weight and someone else you know doesn't, but you can control what you eat, what you do every day. You can try to control stress management and other lifestyle factors. Cardiovascular disease is the #1 leading killer for both U.S. men and women. It does occur at 1 in every 4 deaths per year. You're going to put yourself at higher risk for cardiovascular disease if you're a smoker, drink too much alcohol, consume a diet high in sugar, saturated and trans fat, and sodium is definitely sensitive for some people more than others. Some people are what they call salt sensitive, and if they do eat a high sodium diet, they're going to definitely see that direct impact on their blood pressure. Whereas others may have a higher sodium diet and they may or may not have higher blood pressure. This is something you just want to watch out for. Being overweight, low exercise level, and of course genetics will also play that cardio risk factor. Let's talk about good and bad cholesterol. Bad cholesterol is referred to as LDL. I like to say lousy cholesterol just to remember. The LDL is represented by the gold particles in the diagram. You can see that their job is clotting. They like to clog plaque up in the arteries. They like to make that artery narrow, create that higher blood pressure, and could lead to a stroke or clot factor later. Good cholesterol, on the other hand, is the exact opposite. We love HDL. We love that good cholesterol. Its job is actually to fight against LDL particles. You can see it's represented in green, and its job is to actually go around and fight against, pick up that LDL cholesterol, and actually take it away from the artery. So we do need cholesterol for certain things like hormone production. We just don't want the balance to get out of whack like this picture shows. First place to start is to know your numbers. Know what your current numbers are and what the ideal number should be. Total cholesterol less than 200. Your bad cholesterol hopefully is less than 100. HDL, which is the good guys, again, the higher the better, so at least 50 or above. Triglycerides less than 150, and blood pressure 120/80. If you're borderline high or have a very strong family history of heart disease, you may want to consider getting an advanced lipid test done. This is a test I highly recommend, and I actually had it done, and these are my results. You can see that I tend to be borderline in what they consider those surface markers. Total cholesterol, LDL 125, I'm a little bit in the borderline high range. However, if you look down a little bit further, you'll see another marker called LP little a. This is actually treated a lot like that bad LDL cholesterol, And you can see I'm in the huge red zone. So I'm actually at more risk than I initially thought or what most physicians would have ever known to tell me. Additional markers that are really important to consider for cardiovascular disease would be clotting factors and inflammation. Homocysteine and fibrinogen are both clotting factors, and if you have a high risk for these or these are a little elevated, you may want to look at other things in your lifestyle that could be causing clotting or inflammation. For example, you could be on a medication that naturally already puts you at risk for clotting. If you also have a higher marker in homocysteine, you may really want to consider switching medications or getting it off completely. C-reactive protein is a general marker for inflammation. Most people have at least some level of inflammation. It's going to be elevated if you are just getting over being sick like the flu, if you just broke your leg. Your body's natural response is to create that reaction of inflammation to heal. However, it should not be occurring all the time for no reason. So people with food allergies or food sensitivities, and they cheat a little bit, you're going to have some higher inflammation. And over time, that gut inflammation is going to impact the rest of your system. Cancer. 39% of men and women will be diagnosed with cancer at some point in their lifetime. Now there are several different kinds, but the most common are prostate, bladder, colon, breast cancer, lung, and skin. Genetics do play a major role when it comes to getting cancer. However, lifestyle factors can control turning on or off those genes. You may be at higher risk if you have a lot of sun exposure, whether this is natural or unnatural from a tanning bed, so you'll want to make sure you use a lot of sunblock and sunscreen. If you smoke or use other tobacco products, if you're obese or just overweight, or older age. So as we age, we naturally are going to be at higher risk for cells. As we age, our cells get older, and as our cells get older, they have a tendency to mutate, divide, change. A diet that's highly processed or low in fruits and vegetables. Fruits and vegetables are loaded with antioxidants. Antioxidants are the exact thing we need to fight against oxygenation or exposure to chemicals, and that's what causes cancer. Hormone levels. A lot of people don't realize, but an elevated level of hormones like estrogen can actually lead to cancers. And unfortunately, the more obese you are, the more body fat you have, the more those fat cells are going to actually produce more estrogen and other hormones. So that's how obesity goes hand in hand with disease risk factors as well as cancer. And lastly, infectious agents. So you might hear about, having a low processed diet or trying to avoid chemicals when you're in your cleaning products or shampoos. HIV, hepatitis C and B, these are also infectious agents, viruses and other bacteria as well. Additional cancer tests and screenings. Now, you may not be ready for these tests yet, but just keep an eye on it and make sure you get these tested. So prostate, PSA testing for men, of course, only, would start at the age of 50. Breast cancer, ovarian cancer, now men can get breast cancer, so you do want to, keep an eye out for that. But there are now genetic tests that you can have done, like the BRCA gene. It's a common test that they can now run, especially if you are at high risk because of family. You might be able to do some kind of surgery or preventative measures if you find that you are positive for these tests. Cervical cancer, that should be done annually or even biannually by your OBGYN starting at the age of 21. Mammograms, women at the age of 50 every 2 years, unless you're at really high risk. You may want to get screened sooner and get screened every year. Colonoscopy, luckily you don't have to get that done until age 50, and even better, every 10 years. Diabetes and endocrine disorders. So endocrine disorders or the endocrine system, I should say, is a network of glands that do produce and release hormones. They actually affect pretty much everything in your body. Common conditions that you may experience with endocrine disorders would be diabetes, thyroid disease or thyroid dysfunction, sexual dysfunction, metabolic disorders, and of course osteoporosis or your bone health. You may be at higher risk too if you drink lots of caffeine. Caffeine has havoc on your adrenal system. It actually increases your cortisol levels as well, your stress hormone. If you increase your stress hormone, you're always going to be in that fight-flight mode. And when that happens, the rest of your hormones get thrown out of whack. A diet that's high in sugars and refined carbohydrates will affect your adrenal and your endocrine system as well, just like everything else. Remember, keep in mind, refined carbohydrates are kind of defined as White breads, flour products, chips, crackers, soda, drinks that have a lot of sugar added to them. High level of stress or just chronic stress. Maybe you're that type of person that worries all the time and the littlest things cause stress for you. You may want to consider seeing a therapist or just getting additional training in stress management. Poor sleeping habits. If you're not getting 7 to 8 hours of consistent deep sleep, not everyone sleeps at a high quality of level, or maybe they just don't have enough sleep in general in terms of hours. This can definitely affect your entire body. And endocrine disruptors. We've talked a little bit about this already, but BPA, found in plastics, also canned foods. You can get BPA-free water bottles, or better yet, just get a glass reusable water bottle instead of drinking out of the plastic ones. Pesticides, these of course are on produce. If you don't buy organically, you're going to have a higher level of pesticides. Mercury, which could be found in fish or other food products. Salmon, tilapia, cod, shrimp, scallops, these are all low in mercury. Don't have to worry about these unless you eat them every single day and you eat them in high quantities. And then the phytolates, that's actually an ingredient that's found in a lot of beauty products like shampoos, conditioners, lotions. Again, this is going the extra mile. If you feel like you're already at high risk or you actually have a disease like this already, you may want to consider what steps you can take in your lifestyle that can minimize these risk factors. If you're someone who doesn't feel like you're at risk, or at least right now you're not, you may be okay with using the same shampoo that you've been using. That's okay. Some additional testing you can have done would be fasting blood sugar or glucose. This is, ideally without a meal, without coffee or creamer in the morning. It should be less than 100. Hemoglobin A1C is actually going to give you a really great idea. How does your blood sugar run during the day? How does a meal affect your blood sugar if you just had 2 donuts and orange juice for breakfast? It's a 3-month average of what your blood sugar's been running. Now, fasting insulin is produced by your pancreas in response to blood sugar. That's what its job is. It's a good thing. However, if you're somebody who likes to challenge your body, or you have what they call insulin resistance, your pancreas might be producing way more insulin than it should be, and this is not healthy. So, you may be someone who on the surface has a great blood glucose, but you only have a good blood glucose because your body is overproducing an abundant amount of insulin to compensate. You want to get both of these checked out if you are high risk for diabetes or other blood sugar issues. Additional testing, thyroid. I highly recommend this to get tested, especially if you feel like you have a really hard time maintaining a healthy body weight despite exercising and eating a really good balanced diet. You may also want to consider getting thyroid checked if you feel like you're fatigued all the time, more than the typical person. If you feel like you have a lot of muscle weakness, if you feel like you have a very low heat-cold tolerance level. So say in the wintertime, your feet are always going numb, your fingers, your hands are always going numb, and it seems like you're the only one in the office that's having this issue, you may have a thyroid issue. When getting tested, most physicians will only test TSH, thyroid stimulating hormone. This is a great marker to test for at first. However, you really want to get the entire panel of free T3, free T4 done. This will actually tell you a bigger picture of what's going on. It will tell you, do you not have enough activated thyroid, which is what matters the most, which is free T3. It may also tell you maybe your thyroid's producing enough, but your body's not converting that T4 over to T3. You could have a lot of other issues, but if your TSH is a normal level, you may be misdiagnosed and never be told you have a thyroid issue. In fact, you may be told you have a great thyroid. However, you may actually have an issue. Estradiol, testosterone, DHEA, and cortisol. These are all hormones. A lot of people refer to them as your sex hormones. And they can affect everyone at all ages. They can cause anxiety, depression, mood disorders. They can cause brain fog. They can cause muscle weakness. They can cause you to have poor sleeping habits. Maybe you can't sleep, you have insomnia, or you wake up a lot throughout the night. There's a lot of issues that are connected to hormones. And until you get them checked out, most people are never going to know what their levels are. I always recommend these tests, CBC and CMP. These are panels. Your family physician will probably test these if you ask for a general physical exam once a year. This is going to test for anemia. It's going to test for hemoglobin, hematocrit, and other blood liver function tests. Bone scans, Bone scans are something you have to kind of go out of your way to get done. Most physicians are not going to tell you to get it done unless they know you have osteoporosis. It's actually something you can get at a lot of local universities like Ohio State University, and you just need a physician referral letter to get that done. Not a bad idea if you already know you have some hormonal balance issues or you have a poor diet that's low in micronutrients. And then last, I think we talked about already, the blood pressure. Hopefully you have had that tested at least once a year and it's 120/80. If it's a little high, talk to me or talk to another wellness coordinator and we can work on getting that down. Some nutritional testing has really come around nowadays. We have a lot of advanced testing going on. This is just one example. It's called SpectraCell. I've actually had this done before. And it actually tests for, I believe, about 30 different nutrients. However, most people can just get a regular blood test at their doctor's office and get their vitamin D tested, B12 tested, your stored iron levels, which I call ferritin, and other micronutrient testing as well. Vitamin D is a very common deficiency. Even if you're out in the sun all the time, in the summertime or in the wintertime, we don't have a lot of sun. Most people are below the level of 30, and we really want it to be at least 50. So you may need to consider supplementing. It's one of the few supplements I recommend most people probably need to have. But again, you do want to get tested before just starting to take it. B12 is really important for your metabolism, energy levels. It's extremely important for your nervous system, and especially your brain neurons from communicating with one another, your brain fog, memory. These are all important for B12. So you'll want to get that tested as well. Last, food sensitivity and tolerance testing. I do highly recommend this. If you've had any sort of gut issues, or maybe it's just very mild issues, maybe you tend to get constipated sometimes. It could be because you're eating a food that you're sensitive to, not necessarily allergic to, but you're sensitive to. And the real problem with this is not the common once in a while constipation or diarrhea or feeling a little nauseous or feeling a little gassy, bloated. It's actually the inflammation. You're getting inflammation, and if your gut's inflamed pretty much all the time, even if it's a mild level, you're going to end up getting some of these chronic diseases that most people get because inflammation is silent. They won't know. Last but not least, additional questions to ask. If you go to the doctors and they automatically just say, I'm going to put you on this drug or this medication, or I'm going to recommend this, you may want to consider asking, are there any natural alternatives? Not just because, you're anti-taking drugs or medications, but a lot of those medications have side effects which you may or may not experience. A lot of these natural alternatives probably don't have as many side effects as those have. Also, they could be cheaper, like niacin, for example, is a B vitamin, and you can often take that instead of a statin. It works really well in some people. You may want to also ask, is there a generic version of this drug? Before they write that script up, send it over to your pharmacy, or you walk out the door with that script, just ask, is this the generic version, or is this the only version I can take? Because most likely you're going to save a lot of money if you can get a generic version. You may want to also ask about different services. If your doctor recommends you get a certain test done or procedure done, you may want to ask, is it cheaper to pay out of pocket or bill my insurance directly? I have found, especially with lab work, that if I actually just pay out of pocket, I'm going to pay in the end about half the price. So you're going to want to ask, and if they don't know the answer, maybe consider billing your insurance first, then asking what is it out of pocket, and then going forward, pay with whatever's cheaper. Will the results of that test actually help or change your treatment plan? I think a lot of physicians just want to go gung-ho and test you for all these different things or have you get these different services done. But you really need to ask yourself, okay, if I get the result of this test, is that going to change what I should be doing? Are you going to recommend me to do something differently based on the test results? If the answer is no, if it's just literally to pinpoint that, yep, it's a genetic factor, you may want to consider saving your money and just knowing, okay, going forward, this is what I need to do. Ask them always to him or her, why am I taking this medication? Oftentimes I talk to people that have been on a medication for many, many, many years, and they might remember why they're taking it, but they may not need it anymore, or they might need to change the dose, and this could affect how that person feels and, of course, the cost of the drug. And then last, what are the possible side effects? I think a lot of people aren't aware of blood clotting factors, issues that could happen with certain drugs. They're not aware of muscle soreness that can happen with certain statins. I think everyone needs to, ask, please tell me all side effects that could happen with me with this drug. And make sure you have someone to call in case you do start feeling this way. Last, here's just some references that you can refer to if you want to find more information. Of course, me and the other wellness coordinators are always available if you want to talk directly to us about an individual concern or a problem, or if you just want to kind of get some help changing a little bit of your lifestyle. Thank you again for listening, and stay tuned for the 4-part seminar series on chronic disease prevention coming up next month.